these substances, these chemical compounds that grow in plants or that are made out of plants that are cooked together in a variety of ways, have been present in nature and go back thousands, perhaps even 10,000 years in terms of there being records of them being used in a variety of contexts. They were used in indigenous and shamanic contexts and are central to some indigenous cultures as a sacrament. That is, they're a part of a religious process, but in many indigenous cultures, healing, medicine, healing the body, and religion are not separate. So what is existential distress? Existential distress in this context is pain that results from questioning the very foundations of life, whether my life, whether this life has any meaning, purpose, or value. Existential distress is characterized by fear, anger, terror, sadness at the prospect of not existing, and a loss of purpose in life, and a loss of meaning in life. The goal of the therapist is to support the medicine's effect and the participants' immersion in their inner experience. You know, we did not do very much talking with the participants during their journey unless they really insisted on it. And even then, we tried to just talk for a little while and then have them return to their inner directed work with the earphones and the shades, and the eye shades. We did not give them any encouragement to think about cancer. We encourage them to practice a radical acceptance of all that emerges during the session. When you're with them, they endure and learn and have a profound experience as a result of going to that edge. You certainly see this in psychoanalytic work. I just wanted to make certain to give a nod to Phil Wolfson, who wrote a lovely article about integration in Tikkun magazine in 2011. He points out that integration is a result of deliberate and disciplined absorption in spiritual, emotional, psychological, and activist opportunities. Basically saying you can't just take this medicine and have a journey and expect that it's going to transform your life. And the transformation is a hard work process of integrating what happened to you and what you learned during your journey. Transpersonal psychology is about helping individuals explore their spiritual side and work with repairing any shattered pieces of their souls. So if you ask a traditional psychoanalyst the difference between a soul and a psyche, they won't really have a very coherent answer for you. But a transpersonal psychologist will. A transpersonal psychologist is a specialist in understanding spiritual work, spiritual growth, spiritual illness and malady, spiritual reemergence, and integrating this as part of the human being.